Let me start with a kind of a clarification from yesterday. We talked a little bit about hospital procedures, and let me just state it first. I would love to get back so that hospitals could do any procedure that was needed, that was even elective surgeries, and we're working towards that. And our goal is to get there as soon as we can. There have been two constraints. One is a concern about capacity in hospitals. Because of what you have done, that is no longer a concern. At least it's not a concern now. The other is the personal protection equipment, and that remains a concern. So let me kind of go through this a little bit. In late March, we released an order to postpone elective non-urgent procedures and surgeries. At that time, we stated that these cases were permitted to move forward only if there was, one, a threat to the patient's life, if the surgery or procedure was not performed, or a threat of permanent dysfunction of an extremity or organ system if not performed, if the procedure was not performed, or if there's a risk of worsening of disease or condition if the surgery is not performed, or a risk of rapidly worsening to severe symptoms if not performed. What I was trying to say yesterday is that we want doctors and other healthcare providers in Ohio to reach out to patients who had a case postponed, to reassess the need for that surgery or procedure based on these criteria, and really to update that based on what was going on. During this assessment, the provider should consider the patient's current overall health condition and the patient's quality of life to assess the risk of proceeding with or further postponing the case. If the provider recommends that the surgery or procedure now proceed because the patient now meets one of the four criteria I just mentioned, then we want to make sure a full assessment is done before proceeding with the case. Beyond a reassessment of the patient's health status, healthcare providers should discuss the risk of contracting COVID-19 if the procedure is done. Providers should make the patient aware of all of the things that are being done to reduce the risk of patients contracting COVID-19 in a healthcare setting. With all of that information on hand, the patient and the provider can jointly make the decision on whether to proceed with that procedure or with that surgery. Again, I really want to make clear that if you need emergency care or if your condition is worsening, you should call your doctor or your healthcare provider. If you have chest pain, symptoms of a stroke, or other similar serious conditions, by all means call your doctor, go to the emergency room. Our healthcare facilities across the state are doing a great job at implementing infection control practices within their environment to reduce the risk of transmission of COVID-19. They're making it as safe as humanly possible to be in a healthcare environment by doing the things that you've heard: wearing masks, practicing good hand hygiene, screening staff, screening patients, screening visitors for symptoms of COVID-19, and they're doing many other measures at all. With all that said, we're not ready for the entire healthcare system to instantly turn back on, but I'm anxious to get to that point. Again, I've asked the doctors these comments were based upon what they told me. I've asked them to come back to me very quickly with a plan where we can outline exactly the steps that will take place until we can fully move forward with health care, and particularly within our hospitals and our other places where procedures like that are done. We want to pull back. We want to get the government out of this just as quickly as we can. We still have the problem of the personal protection equipment, and that is just a problem that we have to deal with. We cannot have first responders, people in nursing homes, people who are dealing with people trying to help people who have COVID-19 and not have the protection that they need. So it's a balance. We're trying to work through that, but I'm very anxious to have things really move forward in this area. And I know the hospitals and I know the doctors in the state are as well.